Should you work in the NHS or the care home? As a nurse, you want to migrate, you're now considering where should you work? Which one is better and what is going to be my best option? What are the differences? I've made a video like this in the past, but then I wasn't working in the NHS, so it was just like an abstract. But now I've worked in the NHS for not so long, but at least I'm on my second unit. I worked in 2 care homes and now I'm on my second unit in the NHS. So I can tell you from experience firsthand how I think or what I think about working in the both places. First of all, as a nurse, whether or not you have a BSc in the UK, you can work as a registered nurse with your diploma. As long as you've been to school for 3 years and over, you have your registered nursing license, you can work in the UK as a registered nurse. And whether or not you have masters, BSc, diploma, it doesn't matter. If you're working with the NHS, you're starting as a band 5, and even with a care home, you're eligible to work in the UK once you have your registration. So who are nurses that works in a care home? First of all, what is a care home? A care home is a place where people come to, put their loved ones, or where people who are seen as unfit, unsafe, unable to live in the society or in their own home, they've been seen unsafe or unfit, they then come to this place, a building where it either be owned by a private person or by the government, because some NHS or some hospitals also have care homes, okay? So residents go to these places and they live there. They pay very expensive fees to live there per week. So always remember that, okay? So then as a care home nurse, I have a full video on the expectations and what you're expected to do. You're there to give them medication, take care of their needs, do their care plan, get to know them and give especially individualized care, and to lead the teams you're working with, either carers, domestic, every other person that works with you. You're one of a big team in a care home. While in the NHS, what is NHS? National Health Scheme is government-owned hospitals being sponsored or financed by the taxes and all the things we pay in the UK. But generally, people that comes to use the NHS, they don't have to pay cash in most cases. So the NHS is free and open to all the citizens and residents of the UK. It is what we know as hospitals back home in Nigeria or back home in your country. It is what you term as hospitals, like they are the hospitals where you do procedures, surgeries, you have all the departments. Whereas in a care home, it's just residential home, just like people living somewhere, and if they need specialized care, they have to then be transferred or referred to the NHS. Does it make sense? So those are the two differences, the first one. And then which one should you choose? My first thing I'm going to tell you is, I usually tell everybody that contact me that, look, your first bet will be the one that will give you the job first, because your first and most important aim is to get to the UK. It doesn't matter whether or not you come via the NHS, you come via care homes. Nobody records that. At the end of the day, you're a nurse in the UK, okay? So which one gives you the offer letter to come, give you certificate of sponsorship to come with that one. And most people are glued to wanting to work with the NHS, because with this our mentality back home of, if you're in the hospital, you're the big nurses, the ones that works in government hospitals, they're the ones that are actual nurses, and we that works in private, you're seen as you're less important. But it is not applicable to the UK. It doesn't matter where you work. It doesn't matter whether you care home or the NHS. You are still as valued. You can even get more paid in the care home compared to working in the NHS, okay? So just go for the first one that gives you offer. I've seen people getting glued and getting delayed because they just want to come into the NHS, and I always say that, look, come with the care home, and if you don't like it, you can switch your job. I'm not encouraging you switching your job. I'm saying it is your right to find happiness. Okay, now that you know this, now that you know what the definitions are, let's talk about the advantages and the disadvantages in no particular order. I'll be going all over the place, but depend on what comes into my brain. Let's talk about career advancement. The first one is career advancement. I've heard so many people, even before I came to the UK or before I even joined the NHS, that said, if you're in a care home, you do not get career advancement, you're not going to get more skills, you're going to remain where you are. To some extent, I will agree with that, because if I compare where I was when I was in a care home to where I am right now, the gap is very different. I will tell you, when I started in the care home, although I had new skills, because it is not something I've been doing back home, I wasn't working in the care home. So when I got to the care homes, I had to learn those skills, like moving and handling, care plan. That was where I became master of care planning, individualized care. I got to know my residents, and I was able to transition into the system, knowing all the law, the ethics, adult with incapacity, DNAR. You will learn all those things. Definitely you will learn it in a good way. In fact, even some of the skills, even as yesterday, I still use the nutrition skills I acquired in the care home. I still used it in my department when I was talking about nutrition for my resident and the level of nutrition. So you will get skills, but it will get to a point, depending on how long you've been in the care home, and if you like to learn like me, if you're very inquisitive and you think you want to know more, it will get to a point where you start to feel like you know everything. Although you can't know everything, but to get to a point where you become the local champion. And within 2 years of working in the care home, I was already feeling like I was a local champion, meaning I'm the one that everybody comes to. I know all my residents. I know what they eat. I know what they don't eat. I know, almost everything. And I was not getting any other value, because of course you're going to be the nurse in that care home. There may be only you. And sometimes you're lucky you have more nurses on duty. So you don't have the variety. Doctors will come in few times, or, teaching viability nurses, your specialist nurses will come in once in a while. There was this day I had this patient and they were trying to draw blood, and the hospital at home nurse told me to assist her, to support her. And I looked really stupid, because all the things she brought out, like the vacutainer, all the things she brought out to draw the blood, I have not seen it before, because back home we don't use all these things. And when I came here, I don't get to use it because I'm not allowed. Even though I'm able to take blood back home, I'm not licensed. I'm not allowed to actually do it in the care home. Okay, so I felt really stupid, and that was one of the reasons when I knew that, no, Gloria, you need to go and know more. So talking about career advancement and career progression, if you want more, I bet you need the NHS, because in the NHS they're going to push you. And then it depends on the department that you are. I would say my first department, where I was in dialysis, it is me who is actually pushing myself to enroll myself in training, in courses, in skills. But where I am right now, it is actually too much. They will push you to learn a lot. So you're going to learn a lot. When I mean a lot, I mean you're going to learn more. And I'm not putting down people in the care home. They know their shit, like they know their stuff. But if you want to know more, the NHS is for you. Talking about experience, it's almost similar. You'll get more experience because, number one, you're not just working with nurses in the NHS, you're working with doctors, with specialists. If you like things like that, then the NHS is for you. But if you're looking at comfort, looking at being able to be the local champion and a comfort zone, you want to choose the care home, because in the care home, you get to a point, especially if you're in a good home where you know almost everything and you don't have this this lack of I don't know its mentality. But for me, even up to now, there are days when I go to work and I feel like, Gloria, I have no clue what I'm talking about. Like there's an equipment that comes in and I have no clue what I'm doing until I get training on them. So depending on what you want, it will actually determine what you want to go for. And talking about equipment as well, you're going to get to use more equipment in the NHS, of course, compared to the care home. Let's talk about the salary. This is a big debate. I've heard people talk about the salary of the NHS, as terrible as it is. And even when I started in the NHS, let me tell you, my salary was terrible. But number one, because I was working in a unit where I don't do shift, I don't do night, I only do day. So it's like an outpatient department. So all those extra perks, working Saturdays, working Sundays, working nights, some of these tips, you can get up to a time and 1.6, a time and plus 6, I don't know how I'm going to say, on top of your salary. But I was getting just the basic. So yes, when I started the NHS, my salary was terrible. But right now, I can categorically tell you, and especially since the NHS over the past, I'm not trying to sell the NHS to you, over the past few months, there's been a lot of debate, especially in Scotland. The salary now, I've had 2 increments within I think 4 months, within 3 to 4 months, I've had 2 increments. So I started from so salary, and I'm up by good amount of money. To you, it may be nothing, but at the end of the day, it's still good. And those in the care home, we still argue that they get paid higher per hour. But when you look at the tax and the deductions and everything, at the end of the day, the difference between the salary right now, I'm telling you, the difference is not much. The difference is just by few pounds. I'm telling you, because I know. I'm going to make a separate video comparing my NHS salary with my care home salary when my salary is stable. Just because over the past year, I was working in outpatient, so I didn't have a stable, a standard nurse working in the ward salary where they do day and night. So whatever I'm representing on that salary is not a true reflection. It's only going to reflect if you're working in outpatient. Yeah. But then I moved my job. I changed my job, although I've not told a lot of people, but then I changed my job, and currently I do day, I do night, I do Sundays, I do Saturdays, I do all days, I do all that. But over the time I started, there's been salary increment that I don't actually know what my actual salary is up to now. Up to today that I'm making this video, I don't know my actual salary, because I've had salaries that lump sum, meaning government can just pay us sum of 400 from the increment from last year that I was supposed to have gotten. They are paying also. I'm having lump sums on top of my salary. That being said, I'm not saying I have money. I'm not saying that you're going to earn more working in the NHS. I'm just saying the salary, like I used to think, is not as bad as it used to be, or as I used to think. Because at the end of the day, when you weigh the advantages and the disadvantages, you're going to know. And then if a specialty nurse, you're looking at specialty, of course, you cannot get your specialty in the care home because it's just residential and it's just you and your residents. But if you're looking about your specialty, if you're a theater nurse or a medical, you're a med-surg nurse, you're an ICU nurse, you're a nephrology nurse, of course the NHS is going to be your first call. But it doesn't mean you have to start from there. You can start in the care home and work your way up. And one thing some of us do not know, which I also did not know in the past, is that you don't need to go to any specialty school before you become a specialized nurse. For instance, in Nigeria, especially, for you to work in ICU, you're expected to have gone to the critical care school. For you to work in nephrology, you're expected to have gone to school of nephrology before you can even think about working in those specialties. But in the UK, you learn on the job. People who just finished nursing, like last month, some of them are in specialties like ICU, theater, and they're learning on the job, because at the end of the day, even though you've been taught in school, you actually do not know those things properly until you get on the field. So you learn on the field, and there are people there to support you. So don't be scared. Don't say I don't have experience. But if you have any specialty you think, then the NHS is for you. Talking about life-work balance, I would say to some extent, I will give it to the care home, because it depends on the care home you're working. Sometimes you can have very good rapport with your management that they can allow you to choose the days you want to work, the hours you want to work, the days and the time, and then you can be on maybe permanent night or permanent days. That's what I know, meaning that I'm working so days most of the time. But when it comes to the NHS, these are some of the disadvantages. Although it is still flexible, they will tell you they want to accommodate you as a parent, they want to accommodate you as a pregnant person. But at the end of the day, the demand is the important thing. At the end of the day, you're just a staff there. So in the NHS, sometimes, because you work day, night, depend on your unit, working night, day, you may not have that work balance, that family balance time to actually fit into a good routine, because you can be on day this week and next week you're on night and day before next, or like if you're working in the care home. There was a time I was on permanent day, so I only go to work during the day, I don't do night. And then I was on permanent night, I only do work during the night, I don't work during the day. So I can say when it comes to life balance, you may have it more in the care home. But at the end of the day, it still depends on the unit you're working and how accommodating your manager is in your unit. I've been lucky to be in units where if I have my specific days, I'm like, no, these days I want to work. You can request days as well, even in the NHS. One other big disadvantage in the NHS is that you have a tendency to be moved about, especially now that there's severe shortage of staffs. Not just nurses, severe shortage in the UK. You can sign up to be an ICU nurse, and then you find yourself in A&E. I don't know if they do it in every trust, but my own trust, that is how the NHS saves money. So you can wake up in the morning, take your bag, you're heading to your unit as a theater nurse, but then you get to theater and you don't have patient, and because you cannot just be hanging about, they will move you to another ward. So you can find yourself working in different wards, which can be daunting, although sometimes it is good because you keep up your skill and you learn more. But sometimes it is intimidating because you're going to those units having no clue whatsoever. So you stand the chance of being rotated and moved about. And of course, it is not your father's company, so you have no choice but to go, even though you complain and you're not happy. So those are the disadvantages. Unlike in the care home, if you're going to care home A, you know that is where you're going. Except your patient falls or you're going to the hospital, you're not going anywhere else. You're going to go there. But in the NHS, they can move you from one ward. In fact, there was a time I had to go and work in another dialysis unit in another hospital entirely, just because they were short there, and it is under the umbrella of my own hospital. So I had to leave my own hospital and I went to another hospital to go and work. So those are some of the disadvantages. I don't know if I've covered everything, but generally speaking, if you're thinking about either of these, I hope this video has not confused you. I don't know. I hope with this viewpoint of mine, I've been able to convince and not confuse you too much about which one you should decide on. At the end of the day, it is your choice. It is your aspiration, your long-term goal. I've weighed it out for you, and I hope you make the right choice. At the end of the day, whatever pays your bills, whatever makes you happy, hospital, care home, a nurse is a nurse, and you're as valuable as somebody working in the NHS or the care home. Nobody cares. I wish you good luck in all your endeavor, and as usual, please, I'm begging you, remember to subscribe. Just press the subscribe button for free or press the follow button, depending on where you're watching. I'm on all social media platforms: Facebook, Instagram, TikTok, YouTube, at Gloria Otikor. Thank you so much. I love you to the moon and back. I'll see you in my next video. Until then, stay safe and keep pushing. Bye.